হ্যালো, তোমার কি নাম বাবা? মাহিন। বয়স কত মা? Okay. So, hello, I'm Dr. Tamanna, one of the pediatric doctor here, child doctor. So, today I'm going to examine a respiratory system of Mahi. He is 6 years old, and he came with breathing difficulty for last few days. Mahi, I'm talking to Dekhi Baba. Okay, so first I took the permission from the child and the mother, and then I washed my hands and I made some warm because my hands are very cold. So first of all, I'll do inspection of Mahi. Mahi is comfortable in lying position, and I can see mild respiratory distress he has, but I like to count the breathing respiratory rate in 10 seconds. So Mahi is almost, his respiratory rate is 60 per minute, and I like to see the saturation of the child by the pulse oximeter. Now I will do the respiratory system examination and related general system examination. So first of all, I am doing inspection from side of the chest and foot end, so that there is any asymmetry of the chest. Baba, talking to the I'm looking at the back, so that is there any scar mark or any deformity? There is no deformity, no scar mark. So now I will do after inspection, I will do the palpation part. আমি তোমাকে একটু দেখবো, কেমন? তুমি বড় বড় মুখ খুলে বড় বড় শ্বাস নেবা, হ্যাঁ? I am asking him to take deep breath so that I can see the chest expansion. শ্বাস নাও, বড় বড় শ্বাস নাও. From the 3 area, I saw the chest expansion is normal. Now I would like to see the position of trachea and position of apex beat. একটু চেক করো, আমি একটু এখানে তোমাকে একটু দেখবো, কেমন? I took the permission from the child so that it will be some tickling sensation. And the position of the trachea seems central. And now I would like to see the apex beat, locate the apex beat. And I'm counting the ribs. Then which side is the apex beat? The most prominent apex beat is in the left 5th intercostal space, just below the nipple area, in the midline, mid-axillary line. So it is not displaced. So the mediastinum and trachea both are in normal position, but overall the child's chest looks a little bit extended, distended, and the child has tachypnea, and chest expansion was normal. Now I'd like to see the vocal fremitus. বাবা, তুমি আমার সাথে এক এক বলবা, হ্যাঁ? আমি এক এক বললে এক এক বলবা। বলো, এক 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 So the vocal fremitus seems normal. There is no abnormality if I can feel in my dorsum of my hand. Now I would like to percuss the chest in anterior and mid axillary line. So first I will percuss from the mid clavicular line. I'm reassuring the child that he will not get any hurt. I'm making sure that he is in comfortable position. At the same time, I am comparing the right and left side so that I can understand is there any abnormality. I did not found any abnormality here. My percussion notes was not dull, it was resonant. So I like to now see the back of the child. At the same time, first of all, I will do palpation, to see any restricted movement. There is no restricted movement. At the same time, I will do percussion from the lower border of the scapula. Sure, thank you. Good boy. Now I would like to do auscultation of the lung fields, and I am instructing the child to take deep breath. Ekটু জোরে জোরে শ্বাস নাও, জোরে জোরে শ্বাস। Very good. Very good. Good. Okay. On auscultation, I found there is extensive wheeze all over the lung field, expiratory wheeze. There is no crepitations added, and all the lung fields are involved. There is no other added sound, and now I would like to do some general examination related to this child. First of all, I will see the hands. Okay. I'll see is there any visible clubbing. Okay. There is no obliteration of the angle. Fluctuation test is negative, so the child has no clubbing. And now I like to see the pallor. The child doesn't look pale, and there is no cyanosis, no clubbing, no jaundice. And pulse rate, his pulse rate is, I'm counting 10 seconds. Pulse rate is 90 beats per minute, so it is appropriate for his age. And I would like to see is there any scar mark in the axilla. There is no scar mark. And I'd like to see the temperature of the child by comparing the temperature of other area. There is the child is not febrile. একটু দেখি বাবা উপরে দিকে তাকাও, এরকম করো, চোখ দুটো এরকম করো, এরকম করো, চোখ দুটো। হ্যাঁ, he is not cyanosed. He has no pallor also, and there is no external sign of respiratory distress except tachypnea. জিহ্বাটা দেখো বাবা, জিহ্বাটা হ্যাঁ ulta. Okay, so there is under surface of the tongue, there is no cyanosis also. Last of all, I would like to check the lymph node examination and liver examinations to see the push down effect of liver, and also I like to see peripheral signs of any cyanosis. The child doesn't look cyanosed, and to complete my examination, I'll do plot the child in height and weight with the appropriate growth chart, and also I'll see the saturation, and I'd like to see the peak flow meter as he's 6 years. Thank you very much. Thank you.